Hey, look, if you're a dentist and you hear the word selling and you just feel uncomfortable, you almost have a reaction to me saying it, almost a shudder. Well, this video is going to be for you because in the next few minutes, I'm going to show you how to go from selling to patients or being scared to sell to patients to actually having patients designing their own treatment plans, actually telling you exactly what they want and desire. Now, I know what some of you are thinking, and of course, you are the professional. You will still be handling all the clinical recommendations. But the difference with what I'm about to share is that you will have patients telling you what they want. So actually, instead of just the things that they need, some of the options, the whitening, the cosmetic, the Invisalign, but also maybe a crown instead of a filling, they're going to actually tell you what they want. So let me look at it this way, or let you look at it this way. Many dentists often avoid or they rush through treatment conversations because what they associate, and this may be true for you, is they associate selling with some form of pressure or manipulation, and they often see it as a let me see what I can get from the patient, and they see it as like something they're going to receive, and that feels a little bit dirty. And I understand it, because if your goal is to take from someone, well, I can understand why you wouldn't feel good about it. But what actually happens is, for many dentists, they end up rushing the presentation, or they just avoid certain treatments altogether from being presented because of this fear of seeming pushy. But I want you to think about it like this way. Are you truly giving them, your patients, the highest level of service by rushing things? Are you giving your patients the highest level of service by not recommending things? Are you giving your patients the highest level of service by feeling nervous and often in turn translating how they feel and actually making them feel nervous? Because why this really doesn't work is that you end up, by rushing through things with patients with less clarity, less confidence, less trust. But what ends up really being missed, and this is the bit that I want you to get, is that it's not you getting from them. I believe that dentists have a gift, and the gift is a gift that you can give. Because when someone transforms their confidence, their happiness, their smile, their energy, all the things that you can give to them, that's you actually giving. And I want you to begin to see now, instead of it being something that you receive, be it money or them saying yes, it's actually something you get to give. And I don't want you to miss out on that life changing gift that you can give. And I want you to start seeing this, rather than a transaction with your patient, is a transformation with your patient. That's what this is all about. So to make it real straightforward, I'm going to, for now, give you 3 steps that you can use to really begin to transition from this feeling of selling to this position of serving and giving of the gift that you can. So let's talk about the first step. It's about seeing the patient and finding out from the patient in their words where they are currently at. I call it the desired state. The desired state being where they want to go. Sorry. So where they are currently, these 2 words you're going to hear a lot. Where they are currently, that is their current state. So you really want to find out in their words where they are currently. And then the second step, I got excited and I jumped ahead. The second step is to discover where they want to go. That's their desired state. So let's make it really, really clear. Someone comes in, their current state might be they're not happy with the color of their teeth. And as you dive in and you ask them the right type of questions, they actually say, well, actually, I'm also not happy with how straight they are. Current state. And then you could go into the impact of current state. Impact of current state will often be, for that type of person, that maybe they're kind of holding, they're embarrassed. So in pictures, they don't want to be seen. And that could be affecting their confidence, maybe their relationship. They're going to have their own emotional reasons why. And it's really to hear them and see them for the human they are and experience what they are experiencing in their day-to-day lives in their current state. Then you're going to find out all the emotions they want to feel, they could feel in this desired state, right? That's really the 2, but it has to be in their words. They don't want to speak clinically at this point. They really just want to speak from the heart, who they are as a human, who they are as a person, and how they want to feel. The third step is to see if you've got these two places, there's a gap in the middle. And to get from one place to another, there's got to be some form of bridge. I'm not going to put some cringy pun in there. But there's a bridge to get from the current state to the desired state. Your goal, doing this properly, is simply for you to become the bridge and to help them have a transformation in the way that they want it. And there's obviously going to be clinical guidance in here, but if you get this right, you are no longer selling. You're making a patient feel heard, understood, empowered, and potentially excited about their future. And you might think I'm exaggerating, but you have seen, I know you've seen the confidence that people can have when they get the smile they've always been looking for and getting them out of pain. So you really want to look at this as helping them achieve what they've told you that they want. And together, you get to share this gift. Hope you found this video useful. I'm Zachary Jarvis from Practice Profits.